I am Senior Director in Radiation Oncology in Max Healthcare. Radiation therapy is necessary for most cancers, almost all cancers, but the number of patients that ultimately get it is 80%, because the indication of radiation is not just by the type of cancer, it is also by the stage of cancer, what stage the cancer is in. Sometimes some cancers are in such a stage where maybe one treatment modality can cure it, and that modality, if it is surgery, say in some cases, like for example for early breast cancer, and the surgery has been fully done, breast has been removed, then maybe radiation therapy is not required. So sometimes radiation therapy is not needed, but yes, radiation therapy is indicated or can be indicated in almost all cancers. The procedure of treating cancer with radiation is basically to prepare the patient for the correct focus of radiation and correct type of radiation and correct dose of radiation. Now, how do we do that? We do that by immobilizing the patient in a very personalized cast. It's made of thermoplastic, and that thermoplastic mold, it fits along the patient. Then we do a laser marking, and then we obtain a CT scan, a proper CT scan in thin cuts, so that we can have a three-dimensional orientation of the patient's body. Then after that orientation is achieved, we mark the target, we mark the organs, and we run iterations about of the best way radiation therapy can be given in a modulated manner. Modulation means making sure that the dose is going in the correct place, the correct amount of photons, which is the radiation packets, reach at the right place. This is how we do it. Now, once this is done, then we start doing it on the patient. We bring the patient to the radiation therapy equipment, which can be the linear accelerator or the tomotherapy. And then we transfer the plan that we have simulated on the patient, on the computer, onto the patient after running a quality assurance check. Before we shoot the radiation therapy onto the patient, image-guided radiation therapy protocol is followed, IGRT. And that IGRT protocol, we obtain a scan, we make sure that everything is aligned properly and is in acceptable limits, and then we shoot the radiation therapy. And that is how we prepare radiation, and that is how we deliver radiation. Radiation therapy has side effects. I'm not sure if the word risk can be used, because radiation therapy really does not have any effect which is untoward, like a drug, like a hypersensitivity or some sort of allergy, those type of things which medicines can have. But so I would not say that risks are significant, but there are side effects. And sometimes I like to argue that those side effects are done because radiation therapy is actually a cleanup job. And when we are doing a cleanup job, we do want to give treatment to the tissues which can harbor the cancer cells, so that therefore the surrounding tissues do get radiation therapy. Anyway, regardless, whenever radiation therapy is done, there can be some radiation therapy to the surrounding areas. But if the team and the team and the doctors, they know what target to give, then that damage is almost negligible and is very, very acceptable. We have this image guidance to make sure that whatever we have planned is being delivered. So there is no problem really.